Hi, I'd like to welcome everybody to meeting number 8 of the House of Commons Standing Committee on the Status of Women, starting our first panel on women's unpaid work. For those of you that are joining us as witnesses, thank you for being here. We're meeting in this hybrid format pursuant to the House Order September 23rd, 2020. The proceedings will be made available through the House of Commons website, and the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, here are a few rules. Members and witnesses may speak in the official language of their choice. Interpretation services are available at the bottom of your screen. Pick either Floor, English, or French. For members participating in person, proceed as you usually would when the whole committee is meeting. Masks are required unless seated and when physical distancing is not possible. Before speaking, please wait until I recognize you by name. And if you're on the video conference, please click on the microphone icon to unmute yourself. For those in the room, your microphone will be controlled as normal. A reminder that all comments by members and witnesses must be addressed through the chair, and when you're not speaking, your mic should be on mute. And from that, I'd like to introduce our witnesses. From the Alzheimer's Society of Canada, we have Dr. Saskia Sivananthan, Chief Research and Knowledge Translation and Exchange Officer. From the Canadian Labour Congress, we have Vicky Smallman, who is the National Director of Human Rights. And from Oxfam Canada, we have Diana Sarosi, the Director of Policy and Campaigns. Each of you will have 5 minutes to make your remarks before we go into our round of questions. And so with that, Doctor, we'll begin with you, 5 minutes.
Thank you, Madam Chair, and good afternoon to members of the Standing Committee on the Status of Women. The Alzheimer's Society of Canada appreciates the opportunity to contribute to the committee's important study on unpaid work. Today, I will address how the critical role of unpaid caregiving, specifically as it relates to dementia care, is almost entirely invisible in our society. Our key point to the panel is this: caregiving is essential to our social fabric. The work of caregiving falls primarily to women, with direct negative consequences to them as individuals and society at large. We urge the committee to shape and drive policy changes to reflect a core reality. This is not just a woman's issue. This is a crisis with harsh consequences for all Canadians. And I will discuss this through 3 key points: measurement, acknowledgement, and compensation. There are well over 500,000 Canadians living with dementia right now, and it has a range of symptoms which, over time, destroys a person's ability to function and perform everyday tasks that we take for granted. This leads to the need for 24-hour personal care, and there are no survivors of dementia. In fact, 1 in 2 Canadians is touched by dementia. Women make up 2/3 of all people diagnosed, and more than 60% of caregivers are women. So by those numbers, 6 members of this standing committee could become a caregiver. The impact of this is multi-generational. Wives are more likely to become caregivers for their husbands than vice versa, and daughters make up more than 1/3 of all dementia caregivers. And without adequate home and community care support for people living with dementia, this care falls overwhelmingly on women. So what is the impact? Lisa Raitt, a former MP, is the full-time caregiver for her husband, who was diagnosed with dementia 5 years ago at the age of 56. And like many women, Lisa is balancing multiple responsibilities: motherhood, her work, and supporting her husband. She's unable to do other work until her husband is asleep or unless she has a paid caregiver to support her. And in Lisa's words, the amount of pressure it plays on the caregiver, this needs to be talked about. And so few people talk about it meaningfully in society. I'm the nurse that's charting all the reactions and the treatments. I'm out of my league. And a lot of people do die because of caregiving. They are stress killed. So, measurement. Around 20% of women are forced to give up work entirely to become a full-time caregiver. This is a multifaceted strike against the economy. What happens to the local and federal taxes when thousands of women step away from the workforce? What happens to the investments made in a woman's education by the state or by an organization's investment in her career? In a two-income household, what happens when one of these is lost? So caregiving is not just a woman's issue. Acknowledgement. Dementia itself is already burdened by the stigma associated with the disease, but this stigma also carries to the family caregivers. Study after study demonstrates that caregiving has a serious and long-lasting impact on the mental and physical health of those carrying this responsibility. Combining this with the added social stigma not only increases the negative health impacts on them personally, but on the health system at large. Compensation. Women from Black, Indigenous, and other communities of color are not just those at greater risk of developing dementia, they are the predominant caregivers, either paid in long-term care facilities or unpaid within their families and communities. Yet the skills and strength they bring are rarely acknowledged, valued, or appropriately compensated, even when paid. In fact, unpaid care is important to economic activity and an indispensable contribution to society, much like doctors, teachers, and armed forces personnel. All ensure the well-being of our citizens, yet no one would ask any of them, a surgeon or a soldier or a teacher, to provide their services for free. The 2015 Alzheimer's Disease International Report measured the global impact of dementia, and overwhelmingly, the cost of informal, unpaid care makes up 40% of the overall cost of dementia, which in Canada exceeds 10 billion annually. Women do the bulk of paid and unpaid caregiving around the globe, and it is systematically undervalued. Not only must this work be compensated, caregiving must be an economic priority, providing stability and adequate education to those who must take on this responsibility and make efforts to erase the stigma attached to it.
I'm sorry, that's your time. We look forward to the rest of it on the questions. We'll go to Ms. Smallman from the Canadian Labour Congress. 5 minutes.
Well, thank you for inviting me to be a part of today's discussion. And I'm pleased to appear on behalf of the more than 3 million workers who are part of the Canadian Labour Congress, working across the country in every sector of the economy. I'm very happy that the committee has decided to further study women's unpaid work, an ongoing systemic challenge that has been exacerbated by the COVID-19 pandemic in ways that were well described by the previous witness. The brutal reality is that our economy, our society, cannot function without the unpaid labor of women. There's an unstated assumption that women and caregivers will just be there when things need to get done, and this has been aptly illustrated this year. Gender stereotypes, gender roles are deeply ingrained, and they're systemic. It's not just about individual families and who does the cooking, garbage, or laundry. The impact of this unequal burden is also reflected in wage rates, in labor market participation, in lifetime earnings, in career progression. It's difficult to really tackle the question of the unequal distribution of unpaid work, particularly unpaid care work, without meaningfully considering the issue of paid care work. Who does it, what their wages and working conditions are, as well as the question of how the care is delivered and who has access to that care. That's why the labor movement has called for the establishment of a Care Economy Commission with a mandate to study, design, and implement a care strategy for Canada that would create a broad and inclusive labor market strategy to achieve high-quality, equitable care jobs, examine paid and unpaid care work, and develop a roadmap to meet the increasing demands for care, to reduce and redistribute women's unpaid care work by improving access to public care services for children, the elderly, and people living with disabilities. In 2018, the International Labour Organization released an excellent study on care work and care jobs. And they said that no substantive progress can be achieved in achieving gender equality in the labor force until inequities in unpaid care work are tackled through the effective recognition, reduction, and redistribution of unpaid care work between women and men, as well as between families and the state. The ILO report sets out a 5R framework for decent care work, calling for policies to recognize, reduce, and redistribute unpaid care work, to reward paid care work by promoting more and decent work for care workers, and to guarantee care workers representation, social dialogue, and collective bargaining. Each part of this framework includes a set of policy recommendations. A Care Economy Commission could examine how the 5R framework could be implemented in a Canadian context. While it's tempting to focus on the unequal distribution of care responsibilities within households, it's not enough to look for ways to encourage men to take on more responsibility. We also need to examine ways to reduce families' overall care burden and ensure that the state takes on its fair share of responsibility. Quality public services are essential to the reduction and redistribution of care. This requires a shift in thinking, with human rights at the core of a new approach. Care is a collective concern, not simply a private family matter. People who need care, children, the elderly, people with disabilities, should have the right to the care they need to support to support them, and the care services should be seen as essential social infrastructure. We need to act now. The need for care will only increase as our population ages. COVID-19 made this looming crisis even more obvious, revealing all of the gaps and the cracks in our fragmented and precarious system. For too long, austerity-driven fiscal policies have portrayed care as a drain on the fiscal pocketbook, rather than as social infrastructure needed to sustain strong communities, reduce inequality, and support labor market participation. Canada's market-based approach to care and the offloading of many care services to for-profit companies has driven down wages and working conditions for a workforce that is primarily women, many of whom are racialized. And this has a direct impact on the quality of care overall, something that was demonstrated in long-term care throughout this pandemic with tragic results. For those who cannot find or afford services, the burden falls to often women caregivers. Our collective challenge is to find ways to relieve the short-term pressures of the pandemic while ushering in long-term integrated shifts that will build robust care systems to help us weather future crises. While it's tricky to walk and chew gum at the same time, I'm confident we can do it. So let's make a right to care a reality in Canada, starting with a Care Economy Commission to develop our 5R roadmap. Thank you.
Very good, thank you. Now we'll go to Ms. Sarosi, 5 minutes.
Thank you so much. Dear committee members, thank you for inviting Oxfam Canada to present on the important issue of women's unpaid work. At Oxfam Canada, we put women's rights and gender justice at the heart of everything we do, both here in Canada and in our work with some of the most disadvantaged communities around the world. As a global confederation, Oxfam has been raising the alarm bells on rising inequality over the past decade. In 2019, the world's billionaires had more wealth than 4.6 billion people combined. This great divide is the product of an exploitative and sexist economic system that values the wealth of the privileged few, mostly men, over the billions of hours of hard and essential work that women and girls do every day. As COVID-19 has shown us, much of this work, caring for children, elderly people, and those with physical and mental illnesses or disabilities, and domestic work to keep households running, is essential to our communities, our societies, and our economies, but is nearly all unpaid and invisible. Make no mistake, our economies are built on the backs of women, especially women of color, who provide 12 billion hours of unpaid and underpaid care work each day. The monetary value of unpaid care work globally for women aged 15 and over is at least $10.8 trillion annually, 3 times the size of the world's tech industry. In Canada, women spend 50% more time on unpaid care work than men. Despite increases in women's participation in paid work and changing social norms around the male breadwinner model, men's participation in unpaid care work has not increased in any substantial way. Instead, women have taken on a double burden of paid work and unpaid care duties, increasing their total working hours and reducing their ability to rest. The double burden of paid and unpaid work has been significantly exacerbated by the COVID-19 pandemic. In a study conducted by Oxfam in June on the impacts of the pandemic on unpaid care work in Canada, 4 in 10 Canadians stated that as a result of the pandemic and social distancing measures, their household's amount of domestic and care work has increased, with the bulk of the work falling to women. Over 70% of women surveyed reported feeling more anxious, depressed, isolated, overworked, or ill because of having to shoulder even more unpaid care work as a result of the pandemic. Unpaid work is one of the biggest determinants of women's economic security. Globally, 42% of women cannot get jobs because they are responsible for all the caregiving, compared to just 6% of men. In Canada, too many women are stuck in part-time and contract work due to care responsibilities. The pandemic has severely increased women's economic insecurity. Take the example of Asha, a 32-year-old communications professional who has been steadily promoted in her company over the past few years. She was on maternity leave with her first child until April this year. Then she went back to work, working full-time, without daycare options and no extended family to help her. With her partner working in an essential occupation, she was routinely staying up until 2 or 3 a.m. to meet work deadlines while caring for her new baby. In October, Asha quit her job. Women living in poverty and ethnic and racial minorities suffer more acutely from the social and economic fallouts of the pandemic. In the same Oxfam study referenced earlier, Indigenous women and Black women reported greater challenges due to increased house and care work due to COVID-19 than their white peers. Indigenous women were 3 times more likely as white respondents to say they have had to give up looking for paid work. Women make up 70% of all pandemic-related job losses in Canada, and women's labor force participation has fallen to 50%, the lowest in over 30 years. The best investment Canada can make right now to address the widespread social and economic fallout of the pandemic-induced recession, now termed the she-cession, and get women back to work is to invest in childcare. After decades of dragging their feet and leaving care to market forces, government inaction has resulted in the near collapse of the sector during the pandemic, leaving more families without essential care. A recent survey of licensed childcare centers in Canada found that 70% laid off all or part of their workforce, and more than 1/3 of the centers across Canada are uncertain about reopening. The government's commitment to a significant long-term sustained investment to create a Canada-wide early learning and childcare system announced in the throne speech and underscored in the fall economic update comes at a critical time. Canada needs a public childcare system, and federal leadership is needed to realize it.
I'm sorry, that's your time. We'll have to get the rest of it on the questions. We're going to start into our first round of questions with Ms. Wong for 6 minutes.
Thank you, Madam Chair, and thank you, witnesses. I certainly this is a topic very close to my heart. For the Alzheimer Society of Canada, I've worked with you before, you organized it before, and definitely have already heard about all the challenges, especially for caregivers, whether paid or unpaid. So you hit, the nail right on the head that there are so many important issues related to family care, unpaid job, mostly done by women. Now, my question is, what about support from employers? Because very often women who had caring responsibilities will have to take time off, and also will have to give up promotion opportunities because they want to spend more time. And at the same time, their co-workers, who will probably pick up the rest of the responsibilities they've left behind, will say, how come that this, colleague of mine is always absent, and how come that I'm always doing her job? So, I mean, of course, pandemic has already created more other challenges in the house. But then what about the workplace? Like, in general. So can I ask Saskia to comment on that, please? Yes, your turn.
Yes, I can. Thank you for bringing that up. I think you make a very good point. There are two pieces to it. The first is you're absolutely right. From a workplace perspective, caregiving, informal and formal, has a significant impact on women. But the question for me comes back again to how we economically frame caregiving. Because informal caregiving is seen as it's unpaid work and not adding value, from a workplace perspective, then it can be viewed the same way. And this is why it's essential that we recognize what caregiving is, what the value it is that we bring, and we compensate it as such. Because then it would not be a competing responsibility. It is valuing the caregivers who are providing essential services to the economy. That would be the approach that I think would help us to recognize and move forward the agenda on caregiving.
Yeah, you're exactly right. And on the other hand, the caregivers themselves, sometimes they can be only friends because they are seniors and people with challenges who do not have family at all. And so their friends actually would have to pick up that kind of responsibility. Now I'm coming back to caring for the carers. What about those? I mean, just now I heard from all three of you that, these caregivers are unpaid, suffering stress, anxiety, especially during the pandemic time. What kind of support do we actually, like, for example, just give them a day off? I mean, if somebody can take up some of the responsibility just for one day, it's just like a daycare, one-day daycare for their seniors or for those with Alzheimer. Of course, with pandemic, it's very challenging to do that. So my question to you again for the Alzheimer's Society is that how do we actually, on one hand, of course, we value their work, and on the other hand, we do have to care about them. For example, in England, they have the National Caregivers, Caring for the Caregivers Association, which recommend policies to the British government, what kind of support they have to do. I was able to actually talk with them and visit them when I was the minister. So can you shed some lights on this as well, please?
Yes, absolutely. And thank you so much for bringing that up. In fact, I think Canada has the opportunity to be a leader from a policy and legislative perspective when it comes to caregiving, really driving change. In my previous role, I was with the World Health Organization on the global dementia team. And this was one of the issues we looked at globally. When you look at countries, what have they done from a legislative and policy perspective to support caregivers, recognizing them, compensating them? And sadly, it's very, very limited. Ireland, for example, in 2017, did recognize caregivers and extended financial allowances for caregivers. So this is one of the policy tools that could be leveraged. But outside of that, there are very, very few. And I think this goes back to your previous point about extending work hours, extending allowances, just as we would for women who have just given birth, recognizing that caregiver responsibility and financially compensating for it. And doing so through appropriate policy and legislative changes.
How about the mental wellness? Because, right now, we talk about other challenges for mental wellness. And for these unpaid caregivers, they need that very crucial point to keep them going and also to let them know that they are not alone. So what would you suggest?
Unfortunately, that's your time. We're going to go to Ms. Sidhu for 6 minutes.
Thank you, Madam Chair. Thank you all the witnesses for being here and giving us valuable information. My first question is to Dr. Sivanathan. You make an excellent point on caring for the caregivers. That is why our government recognized this with the Canada Caregiver Benefit, because we know it is very important for families. The other question just I want to raise, without a doubt, one of the most devastating outcomes of the pandemic has been on long-term care homes. It is a fundamental responsibility of all of us ensure that our seniors are safe and well cared for. Just this week, our government announced $1 billion for Safe Long-Term Care Fund. In the partnership with the provinces and territories, we will establish national standard for long-term care facilities. We also made the largest investment in home and community care in Canadian history. Doctor, other than these investments, what can the federal government do to help seniors age in the comfort of their home? Additionally, what can our government do to ensure the safety and well-being of the family members who want to be involved in their care?
Thank you for that question. And I do want to actually first address your earlier point and commend the government on making that investment and in committing to bring forward these national standards that are so essential and necessary in long-term care. And in fact, as a point to that, within long-term care, where the majority, again, of personal support workers who are providing those daily care duties are women and are women of color. And part of the concern and issue has been that these women are not being appropriately compensated. They're not being given the appropriate benefits that they require. They're not even being given appropriate full-time employment. And so they're trying to make ends meet by taking part-time care at part-time work at multiple locations. And in fact, I was speaking to a long-term care director just the other day who talked about the difficulty where many personal support workers are being forced to leave this work and in fact work for their local LCBO.
Madam
because
Chair, there's a point of order.
Point of order from Ms. Sahota.
There's 6 Liberal members on right now.
I believe that
Point of order, I'm here as an associate member. Should Sidhu have to attend to a family matter, then I will step in for her, again, as noted from the previous meeting.
Correct. Thank you. Sorry to interrupt.
No, it's no problem. Just to wrap that point up, it was that personal support workers were working at their local LCBOs because they had more stability and better compensation. So even for paid caregivers, such as personal support workers, this is an issue. For home and community care, however, where the government can again take more ownership and really move forward the agenda is by building more robust home and community care supports so that seniors, people living with dementia and their caregivers have the appropriate supports to be able to age at home and in their communities.
Thank you. For the other 2 witnesses, anybody can answer that. Our government recognized the extraordinary toll the pandemic has taken on women. You talked about the women's on colors, Indigenous women, but we are moving forward with our plan to create a Canada-wide early learning and childcare system, beginning with the Federal Secretariat to support this work and new investment to support early childhood educators. How do investments in early learning and childcare and long-term care help address the challenges and barriers that come along with the non-paid work?
Maybe I'll start. I don't know. Deanna, is that okay? Just to say, I mean, I think the investments that were announced this week have been very welcome. The establishment of the Secretariat is an essential step towards building a comprehensive pan-Canadian system of early learning and childcare. What needs to happen next, though, is, and in short order, is the funding necessary to sustain the creation of a system in a long term. So, you know, without that, we will not get closer to the kind of universal access that is required to redistribute that unfair burden onto that is currently shouldered by women and enable their participation in the labor force. Deanna, I don't know if you have anything to add.
Yeah, what I would like to add is around how this money is spent. So, you know, obviously this is going to provinces and territories through their transfers. And at the current time, there just aren't enough sort of measurements and targets put in place to ensure that that this money is actually spent in a way that it increases affordability, quality, and flexibility in childcare. So that is one thing I think that needs to be strengthened through the multilateral framework that currently exists with the provinces. And then one thing I would like to underscore, also touching a bit on what was previously said, is the fact that there is a bit of a difference between elder care and childcare, in the sense that childcare does really provide sort of a path for women to enter the workforce that wouldn't be possible otherwise, because they have children at home. It's not quite like that for elder care, for example. So childcare really is sort of a stepping stone of increasing women's participation in the labor forces. And
I'm sorry, that's the time for that question. We're going to go to Madame LaRouche for 6 minutes.
Merci beaucoup aux témoins pour vos témoignages qui sont touchants. Je pense.
Thank you for these testimonies. It's touching us. This unpaid work is everywhere. It's volunteer work, it's caregivers, and even women who have to work more in the family. But maybe we don't have enough data. There is a Quebec association, FEWO, and I would like to ask you questions after I had an exchange with this association. What are the statistics for this unpaid work during the beginning of the pandemic so we could compare? We talked about impact on some economic sectors. How about some statistics on invisible work? I think Statistics Canada should get some of this data, because we don't have a big picture of this unpaid work in Canada. We should have a reality check and know what it really does represent in Canada.
Reply quickly to that. That's an excellent question, and I think data is extremely important to helping us shape a coherent policy response to a systemic problem. The general social survey that Statistics Canada conducts does analyze the time use. What you need is a time use survey, but I do think that a sort of pre and post pandemic look at unpaid care, or how Canadians use their time, is extremely important. But the data does exist to some extent. It just may not be taken as regularly as it should.
This was really the impetus of why Oxfam Canada conducted this survey in June, because we felt there just wasn't enough data and understanding of how things have shifted throughout the pandemic. And as I mentioned, the burden has definitely increased, but again, it hasn't been equally increased for men and women. So women do really feel like they're sharing, having the lion's share of these additional responsibilities. And of course, that sort of differs with whether schools and childcare spots are open or closed. So even that in itself is something that will need to be factored into those.
And if I could add to that as well, we are conducting a national survey with caregivers to address exactly that same issue, to understand what has changed pre and post pandemic, and we are in fact also conducting a research, a national research scoping project to look at the data from the administrative data, the health system data, to understand how this has shifted, how the pandemic has also maybe shifted people's ability to access the healthcare system, and to access the resources in home and community care that they would need. And of course, by that, you would indirectly be able to measure the impact on caregivers who then are having to make up for not having access. But this is an excellent question. We need to measure it appropriately to be able to drive the appropriate policies forward.
Ces données-là sont
These data are super important, and it would help us support those who do invisible work, the caregivers, and we're talking about home support. You did talk about it. What about the health systems? This week at the Bloc Québécois, we tabled a motion to congratulate professionals of the health system who are working during the pandemic. You know, if we support the health system, it'll support caregivers. International or national standards won't help us to take care of people, but we have to increase the health transfer to 35% to give a chance to the health system so people can be better paid, and those who day after day offer care to people. And I can tell you that the health systems are definitely underfinanced in Canada.
Yeah, I would totally agree, which is, I mean, I think unless we invest in robust healthcare and other care systems, we're not going to be able to address sort of the gaps that have been really exposed by this crisis. So, but you can't just provide funding. There also has to be a coherent strategy to ensure that we are expanding the system in the ways that will help relieve the burden of on unpaid caregivers, this invisible labor. So, you know, we need an expanded home care system. We need the kind of respite care that that is available to help to relieve the pressure on family caregivers. You know, we need better options. And if we shift to see the need for care, whether it's health care, home care, care for persons with disabilities, child care, as a right, rather than as a kind of as an expense, a drain, then I think that that's what we really need to be able to build the sort of robust systems to help us into the future.
Very good. And now we'll go to Ms. Matheson for 6 minutes.
Thank you, Madam Chair, and thank you to all the witnesses. So this week we saw the announcement of the fiscal economic update. And within it, and also when previous members had discussed the caregiver credit, I mean, I find these to be half measures, temporary measures. We know that money is being given to childcare, but it's not what experts and stakeholders in the system have asked for. It's actually far less. When there was an announcement for long-term care workers and increases, I believe that the number was that 4,000 would be, they would try to achieve a number of 4,000 when we heard in Ontario alone to provide the 4 hours of necessary care per day, Ontario alone would have to hire 10,000 additional healthcare supports and workers. So, Diana had mentioned that while all this money is being put into place, there doesn't seem to be strings attached to it. So in terms of going forward, how we look at these long-term solutions, how we get into it, Ms. Melman had talked about implementing them with that future focus, with that long-term focus. So how would something like a Universal Child Care Act or national standards in an act that fell under the Canada Health Act to ensure that universality, to ensure that fairness, how would that help build up those systems?
Yeah, that is actually something that the childcare movement has been calling for many years now, is to actually legislate childcare. And I think that goes back to that point that care is a right, but also to shift our economic thinking around what is an investment and what is in cost. You know, the benefits of a public childcare system in Canada would be tremendous. It would generate government revenues by up to 29 billion, so therefore paying for itself. It would increase employment for 725,000 women in Canada and increase GDP by $100 billion a year in 10 years from now, which is how long it would take to set up such a system. So I think it's really time to stop thinking of these kind of investments as a drain on the budget, but really seeing it as an investment that will help us to tackle these issues systematically rather than trying to sort of leave it to market forces or leaving it to sort of individual benefactors.
If I could add to that as well, I very much agree with the last witness that shifting our perspective of caregiving as value adding, value generating to the economy is crucial to how we would then be able to shape policies. And from a dementia perspective, we currently have a national dementia strategy. However, it is not a fully funded national dementia strategy, and it still does need to be implemented. And the proof will be in the pudding. It'll be in how we implement. The strategy will help with setting the roadmap, but we have to think about the implementation of that strategy, because that is where the home and community care, the long-term care, appropriately paying the personal support workers, compensating them and the benefits that they need, appropriately compensating and building a robust home and community care, that we will be able to support the invisible work and the caregiving that is occurring.
That's perfect. I also wanted to add, so a previous witness had discussed wealth inequality, and as New Democrats, we are consistently trying to work on that, trying to address and introduce a wealth tax, close tax loopholes, tax havens. The government seems slow to this. Now, we talked about the inequality that existed there in terms of how workers within the system are valued. Certainly, they require more workers, but paying them more is certainly a big deal as well. So the government had promised, hasn't delivered yet, on a $15 minimum wage, federal minimum wage. They are also supposed to implement pay equity legislation that actually hasn't been acted on yet. So how would those things also help women workers in all fields?
Well, I mean, I certainly feel quite strongly that we need to have the pay equity legislation enacted yesterday. But for care workers, many of them are covered under provincial and territorial labor legislation, and so we would need to have some legislative action there. However, federal leadership in raising a minimum wage and bringing in proactive pay equity is super important to helping usher in changes at the provincial and territorial level. I do think, though, that a lot of this involves, the way that we raise the wages, the way that we address the poor working conditions and the undervaluing of care workers in childcare, in healthcare, home care, long-term care, is to really examine and have a coherent strategy. And I do think, back to the previous question about enshrining the right to care in legislation and connecting sort of investments with and recognizing in that law that quality care depends upon decent work and working conditions and wages for care workers is essential. Uruguay did it.
And that's the time for that one. We're going into our second round of questioning with Ms. Shin for 5 minutes.
Thank you so much. I'd like to thank all the witnesses that are here today to speak on an issue that is very important, especially during this COVID time where there are extra strains on women. We're talking about a framework, federal strategy. So in order to understand what that course might look like, I would like to ask, are there any statistics available about what has caused women to be care workers who are unpaid pre-COVID? For example, was it socioeconomic reasons? Is it a cultural expectation? Is it just personal volition because they want to be in that role? Recognizing that there are some benefits they can miss out on, such as pension and retirement income. So are there any statistics that you can speak into on that? Any of the witnesses?
I mean, I'm not sure if statistics can get us into, I mean, the ILO study that I referred to is a global study, but I mean, the dynamic of the gendered expectation that women provide unpaid care and the disproportionate sort of numbers of women in the care workforce is well documented and you know, globally and in Canada as well. So the ILO you know, the ILO study would be a really good place to start. There's also a number of Statistics Canada surveys and publications like Women in Canada, which also get at this dynamic. I mean, the reality is that no matter what, is that all women provide, unpaid care. The problem is that some women can afford to contract that out to hire caregivers, whether it's domestic workers or other workers, and it's those workers that are also undervalued and underpaid. So we have a bit of a dynamic there that has a disproportionate negative impact on women's economic security and economic justice that needs to be. It's not really about individual volition. This is a systemic problem that goes very deep in our society.
Thank you for that. Seeing that COVID has created issues with interaction because of social distancing, what does respite support for caregiving women look like in this climate? And what can we do differently? What can the federal government do to help them get some rest and some breaks?
I think a big part of that is even just the lack of paid sick leave for many workers in our economy. So I talked about the double burden of care, paid work and unpaid work. And so then if you can't take a day off from your work because you don't have paid sick leave, that absolutely adds to the stress and overwork that women are experiencing. So even something simple like that, that women actually have access to paid sick leave would be a helpful first step.
Thank you.
And if I could add to that, for home and community care and respite care, particularly for caregivers of people living with dementia, during COVID, we have been receiving an increased number of extremely distressed caregivers because they no longer have a break, they no longer have respite care, they don't have access to adult day programming, they can't access personal support workers who could come into their home and support them either during COVID. And a lot of this also has to do with the increased caseloads that the home and community care staff themselves are now trying to manage because resourcing has been shifted to acute care or to long-term care. So thank you for raising the question, because again, it goes back to the implementation of a strategy. And in the National Dementia Strategy, we talk a lot about home and community care, but appropriately implementing and supporting home and community care so that you have enough hours provided in terms of respite to a caregiver, providing enough staff support and education and training so that they can go in and provide support into homes where people living with dementia need that support. This is where we need to focus.
Thank you.
And this is actually one of the reasons why the childcare sector is continuously struggling with this retention and hiring crisis because the working conditions are so poor. Women just burn out and there are no benefits available to them. It's one of the lowest paid and most precarious jobs in Canada. So with those kind of working conditions, it's very difficult for women to maintain their mental health.
Very good. Now we're going to go to Ms. Dillon for 5 minutes.
Thank you, Madam Chair, and thank you to all our witnesses for being here and all the work you do. Before I begin, I'd just like to clarify that healthcare is a provincial responsibility, and I think it's very important to make this correction. The other thing is, I'd like to also say that our government is committed and has committed itself to in-home care, According to studies and experts, it's very important that when people reach a certain age, they be able to continue living at home in the comfort of their home. It prolongs life. It helps make their health better, and it keeps them just mentally and emotionally strong. My own grandmother, we were caregivers to her. She had strokes and was bedridden, and the entire family was helping, and even with the family helping, it was very, very difficult, very taxing emotionally, mentally, socially. When it comes to work, we had to juggle our schedules, but we didn't want to put her in a home. And it's cultural too, I have to say. We don't put our elderly in homes, and it was very difficult, and she was almost 8 years bedridden. And listening to all of you and knowing what the people who are caregivers go through, my heart resounds with them. And I'd like to start with Ms. Sivanathan. You mentioned before that a lot of women of ethnic or people of color are the ones who end up, most in these cases diminished. And especially with COVID, what already was there has just become worse. I'd like to know from you, please, because we need to get to the root of the problem as well. Why is this happening? Why are people of color more vulnerable, Indigenous people more vulnerable to COVID? And what can we do in the future so that this doesn't happen? Is there racism against them to begin with? Job discrimination where they have to, like you said, work at the LCBO? What is causing this level of society to be even lower on a social or economic aspect? Please let us know and take your time. Thank you.
Thank you for that, and I appreciate your comments, particularly about caregiving and caregiving for your grandmother, because I think it speaks to that personal connection and understanding. To your question about the racialized communities of women who are providing caregiving, you would have heard from the other witnesses as well. This is not only for caregiving when it comes to seniors or people living with dementia. It's across the board when it comes to caregiving. You see it for childcare as well. And there are many, many reasons for why that is the way it is. Socioeconomic status is certainly one of the contributing factors, and there are social factors that really contribute to it. But I think the underlying piece that I would like to emphasize is that if we valued caregiving economically and if we compensated for it appropriately, it should not and would not matter if it is racialized women. It would be that even despite being racialized, you're being compensated appropriately for the skills that you are bringing forward. And when it comes to dementia, people of color, Indigenous, and people from Black communities are at higher risk of developing dementia as well. So I think the root cause I'd like us to go back to is that, again, caregiving adds value to the economy, and that if we view it as such through that lens and drive policy that reflects that, the racialized nature of caregiving can be addressed as well.
If I could add to that, if you're trying to make a profit out of providing care, the only way you can really do that is by cutting wages, right? I mean, care, it can't be substituted, automated, and so on, right? So if you want to make profit of that, you're cutting people's wages, and that's what's been happening in this sector for many, many years by leaving it to market forces and competitive forces. And that's why these public investments in care are so crucial to be able to maintain labor standards that ensure greater equality no matter what racial identity you have.
Perfect. Thank you to both of you. And Ms. Smallman, would you like to add anything? I see you were about to say something.
Well, I mean, I just could completely agree with both of the statements. Ultimately, it comes down to a broader patterns of inequality that are throughout our society. And the way that we really deal with it is by developing policy solutions with the people who are most negatively impacted at the center, at the core, right? So if we bring that kind of, gender based intersectional lens to our policy making, if we think about, how do we lift up the people who are most impacted when we are developing solutions, as opposed to how do we reduce the drain on the public purse, or how do we make sure that companies can make a profit, then we might be able to address some of these systemic patterns. So it really is also about changing the way that we think about developing policy to address some of these systemic problems.
Excellent. Now we're going to go to Madame LaRouche, 2.5 minutes.
Well, as senior spokesperson and women's spokesperson, I want to thank all three witnesses. You're really telling us about the importance of invisible work for that clientele and the importance of paid work too, and pay equity. That's why, quite humbly, I will submit the following motion to the committee, because I really get the impression we have no more time to waste, no more meetings to waste. So I'd like to table this motion that the Standing Committee on the Status of Women meet December 7th at the latest to finish the debate started today on future business in order to maintain the schedule we had for next week. Because I say this very humbly, because we have a lot of work to do and we cannot waste another meeting and not discuss unpaid work.
Okay, so any discussion on the motion?
I'd like to make a point of order, please.
Ms. Dillon.
This motion, yes. Was this motion on notice?
It's on the topic that we're discussing at the committee.
Madam Chair. It's not on the current debate. It's not part of that. No. Thank you.
Je dépose une motion sur le champ. On pourrait
I'm tabling a motion. I think we could. I just want to try to have us meet next week.
In this meeting, it has to be under committee business. So you have another half a minute of your time for questions.
So if somebody wants to finish by reminding us of the importance of invisible work and how the pandemic has revealed the inequality between the sexes, and I'd like to hear you about that.
I'm suspending the meeting momentarily. End of our time for today. And so I want to thank the witnesses for your excellent testimony. For the committee, remember to bring your COVID recommendations for the COVID study by Monday. And Tuesday will be, of course, committee business. Meeting's adjourned.